In terms of wounds, basically I've had probably 3 ulcers over a 20-year period. Generally, I have ascribed them to over-enthusiastic scratching. I have very bad psoriasis, and the ankle area is one that particularly itches. The only intrusive parts of the trial were the biopsies, which aren't that bad. Basically, it's little more than an injection. It bleeds, and you look down and it looks bad, but it doesn't feel bad. I seem to remember they gave me some sort of injection beforehand as well, so as I say, I certainly didn't see that as being problematic. I found both the doctors and nursing staff here on the trial to be very sensitive and concerned not to give me any pain where they could avoid it and what have you, as do the team at the clinic. So I have no complaints about either batch of treatments, either the standard or the tissue trial. They've both been excellent. This is my final arranged visit of the trial. I think it's month 7 I'm at, and we've got a very detailed explanatory letter at the beginning that gave the frequency of the treatments and what would happen at each one, the ones where I would require a biopsy and the ones where it would just be a dressing change. And as I say, this is basically the final one. So today I either get signed off or Dr. Greaves wants to keep an eye on just to see it to its conclusion. It's quite painful. A big ulcer, and I'm talking about something that's exceeded that size when it was at its worst, and the secondary one, which was quite deep, that are painful. And I've had a regime of constantly changing painkillers, so I didn't get used to anything. And as the trial's gone along, the level of pain has decreased. I've had 2 periods of 10 days each when I've taken no painkillers. You know, it's been that good. You have a good spell, and then you have a biopsy, and then you have not a bad spell, but you're back on the painkillers to keep it under control and so on. But no, it definitely has improved since I was on the trial in terms of lessening pain. I already have. I had a friend I bumped into, our children went to school together, and I bumped into him at the clinic about probably 6 weeks ago, and we swapped stories. And I said, get hold of Withington Hospital. I said, I don't know if this trial's still ongoing, but try and get on that. It'll work wonders for you, John. So yes, I would definitely. He's actually now being treated by Withington, but not obviously on the trial because it's coming to an end. But I would certainly advise anyone that has the opportunity to give it a go. It's like anything, it's like insurance. You don't want to use it, but by Jove, you're glad they're here when you need them. And they're a smashing team here at the hospital. And at the clinic, I take nothing away from the nurses that look after me on a general basis.